she'd been putting off her knee for almost 2 years. Not because she wasn't in pain, because every time she looked up the cost, she closed the tab. I'm Emma, a medical concierge in Chengdu, China. Sarah, 47, from Auckland, had been managing persistent knee pain with over-the-counter medication and reduced activity for nearly 2 years. Her GP had recommended an MRI to assess the extent of soft tissue damage, but the out-of-pocket cost in New Zealand and the specialist referral wait had made her hesitate repeatedly. When she finally reached out to me, she had already postponed the appointment 3 times at home. On the morning of her appointment, Sarah was quieter than most patients tend to be early in the day. She didn't ask many questions on the way to the hospital, which I noticed. Some people talk when they're nervous, and some go still. She was the second kind. 7:40 a.m. Met Sarah at her hotel entrance. Light morning traffic meant we arrived earlier than scheduled, which gave us time to sit in the lobby before heading up. 8:20 a.m. Completed registration. I handled document submission and payment at the orthopedic imaging counter, while Sarah kept her belongings with her. 8:45 a.m. Arrived at the MRI department. Sarah changed, completed the standard metal screening form with my assistants, and we confirmed the imaging protocol with the technician. 9:05 a.m. Scan began. Knee MRI typically runs 30 to 40 minutes in this configuration. I waited outside the suite. 9:50 a.m. Imaging completed. Sarah came out moving more carefully than when she went in. The scan itself isn't uncomfortable, but lying still for that long on a tender knee takes something out of a person. I had a bottle of water ready. 10:35 a.m. Report released. I translated the key findings for Sarah at a quiet table near the department. When I finished, she looked at the document for a moment and said she hadn't realized how much she'd been holding until someone finally told her what was actually there. 11:10 a.m. Coordinated a brief orthopedic consultation to review the imaging findings and discuss what next steps looked like, whether that meant treatment in Chengdu or guidance she could take back to her GP in Auckland. At home, Sarah had been looking at a referral queue, a separate imaging booking, and then another wait before any specialist could even review the results. In Chengdu, she arrived with a question and left with an answer. Same day, one location, complete picture. If you've been putting something off because the cost or the wait felt impossible, I'm happy to tell you what it would actually look like here. Day with Emma, Medical Concierge.